Vanakkam, Namaste and welcome to Dr. Shah's clinic. My name is Dr. Shah and I'm a consultant in male infertility and sexual health. And in this video, I'm going to answer a very common question I get from my patient. And the question is, dear doctor, why do my balls hurt? Or is testis pain a problem? Now, as a practicing andrologist, I have seen numerous patients who come with the complaint of why do my balls hurt? And there are 5 to 6 or maybe about 7 common clinical conditions in which testis pain becomes an issue to be treated as well as looked out for. The first common clinical condition in which can cause pain in the balls or testis pain is a condition called epidydimo-orchitis. So, in epidydimo-orchitis, what basically happens is the bacteria or infection basically affects the testis, which is the sperm producing organ inside the scrotum, as well as the structure above the testis, which is called the epididymis, which is basically a storage organ for the spermatozoa. What happens is when both these structures actually get infected, obstruction can result, and male factor fertility problems or male factor infertility can actually result if left untreated. So if you notice pain in your balls or pain in the testicular region, along with burning sensation while passing urine, as well as fever, epidydimo-orchitis should be investigated as well as systematically treated for. Now, the second common clinical condition where a patient can have severe pain in the balls or in the testicular region is a condition called grade 3 or grade 4 varicocele. Now, what basically happens in a varicocele is that the venous drainage in the testis does not go back properly upwards into the systemic circulation. There's a stagnation of blood within the testicular region. So, because the papilliform plexus of veins are not functioning properly. That's all we know about varicocele. In some patients, if the venous stagnation of blood is very high, a dragging sensation of pain is usually produced. In these cases, surgery may be recommended for patients where the quality of life is actually going very low. However, grade 1, grade 2, and in select cases grade 3 varicoceles usually we do not recommend any kind of surgical intervention. Now, the next common clinical condition that can probably lead to testis pain or pain in the balls is a condition called hydrocele. Now, what basically happens in a hydrocele is that there is a fluid filled fascia that actually there is a structure that surrounds the testis. It's called the tunica vaginalis. So sometimes fluid can accumulate between the testis as well as the tunica vaginalis layers, and what happens is the fluid accumulation happens, the testis becomes slightly bigger and becomes bigger and bigger over a prolonged period of time, and that can lead to a dull aching pain specifically in the testicular region. Now, although hydrocele does not strictly affect the male factor fertility potential, an important point to bear in mind is that it can produce a dragging sensation in the balls, a sense of heaviness in the balls, and if the size becomes very large, a surgical intervention to correct the hydrocele may be required. Okay. The next clinical condition that can cause pain in the balls or testicular pain is a condition called testicular torsion. You heard that right, testicular torsion. What happens in testicular torsion is, if this is the blood supply of the testis coming from downwards, and if the testis is like this, in testicular torsion, the testis basically rotates on itself and the blood supply here basically gets cut off, and that causes severe agonizing pain. Patients cannot even sit. The pain is so severe that they cannot even sit. Patients have nausea, patients have vomiting, patients develop fever, and testicular torsion is a medical emergency. You need to meet your urologist at the earliest if you find pain that is so severe, that is dragging, that you are not even able to sit. Testicular torsion has to be suspected. Now, the next clinical condition in which you can have pain in the balls or that can cause testis pain is kidney stone. Now, interestingly, some patients develop really large renal stones, and the pain can radiate all the way down into the testis, into the testicular region. But the pain usually originates somewhere here in the lumbar region, that is in the sides, but the pain can radiate downwards into all the way into the groin area. So if the patient has fever with nausea, vomiting and severe pain originating in the lumbar region, then radiating down all the way into the groin area, a kidney stone has to be suspected as well as treated for. So I hope you enjoyed this short video on the various causes as well as the various reasons for testicular pain. I hope you found some information useful in this video. Do comment, do like, and do subscribe. Please share this video with all your friends and loved ones. This is Dr. Shah. Vanakkam and Namaste.